This is Steve Heuer, physician assistant. First, I'd like to talk about the pathway to surgery. I've broken this down into basically three parts. First, getting started and getting through your consultations and assessments. Following that, we'll have our education and training and various tests and studies, making sure you're ready to move on to the surgery. And then, of course, we have our surgery and pre-op diet and pre-op visits we'll bundle as our third step. It's important to know that everyone's path is unique to your particular needs and challenges. Some folks can get through this program in 7 months. Sometimes it takes longer, 10 months. Sometimes it might even take a year or more. Really, our goal is to make sure that you are well prepared and maintaining a lifestyle that is necessary to be safe and successful after your surgery. Okay, first step is getting started. By the time you're listening to this talk, you've already established with the WellBe account. This is a very powerful web-based tool providing all sorts of information both before and after surgery. Please rely on this tool to help guide you through the pre-op and post-op period. So you'll have a consultation with your surgeon. You'll meet with our dietitian and health psychologist for a longer visit. You'll also complete some personality and health psych questionnaires. We try to do this, we try to schedule all these visits in 1 day, maybe 2 days, so we're more efficient with your time. But that day that you're here is a pretty long day. Our team meets regularly to talk about all our patients. We'll talk about your case as well and determine really what your specific needs are and any certain goals or workup that needs to take place as you prepare for surgery. Of course, we'll be staying in touch with you to make sure that you know where you are on the program. Again, WellBe is a great tool to help assist you and remind you of your to-do list. We have a 6-month educational training course. The course is basically there to help you train for bariatric surgery. Learn more about your surgery, learn about and practice lifelong skills and habits, start to get rid of some habits that are not going to be safe after the bariatric surgery. Hopefully we can get you to ramp up your activity a little bit more, talk about stress management and boredom management skills. There's a whole wealth of information that we'll be going over in our classes. These are more small group sessions, really meant for you to be involved and interactive with the facilitator. So month 1 and 2 are small group sessions. You'll attend these. They're facilitated by myself, our health psychologists and dietitians. After that, month 3, you'll have a one-on-one visit with a dietitian and health psychologist to see where you're at, how you're doing. We'll also coordinate a wellness class in there, which is more focused on mindfulness, physical activity. Month 4, you'll have another small group session facilitated by the dietitian and health psychologist. Also during month 4, you'll attend the second wellness class. We'll be doing, I believe we're meeting in the kitchen here at the American Center and practicing some food skills and preparation skills, as well as protein shake skills. At month 5, we'll have one more small group session. We call that small group session 4. And month 6 is another one-on-one set of visits with myself or our nurse practitioner, also with your dietitian and health psychologist, just to kind of wrap things up and see where you're at. Have you made some changes? Are you ready to move forward with surgery? Do we feel confident that you are ready to move forward with surgery? The wellness classes are held Fridays in our learning kitchen here within the American Center. The small group sessions are held on Wednesdays or Thursdays throughout the month. It's important to know that you'll be attending one of these per month. We do not contract these to do multiple visits per month, so it is at least a 6-month course. There are various tests and studies that will need to be done. Most patients will need some form of blood work, perhaps a stress test for your heart, perhaps a sleep study to see if you've got sleep apnea. Some of our patients require an endoscopy to take a look at your upper anatomy and stomach. There are various other tests and procedures your surgeon may or may not order. Every patient's workup path is unique to that patient. And we'll help move you through the process here and make sure that these things are getting done in a timely manner. Once you are ready, you've done your workup, you've made some major changes, you're sustaining good lifestyle and have a great understanding of what's required of you, that's when we move forward with surgery, with scheduling your surgery. You will have a pre-op surgery class. You'll attend that. That's typically on a Friday afternoon. You'll have a readiness visit with myself or a nurse practitioner. You will have your history and physical visit with a surgeon, and we'll get some pre-op labs done. At surgery class, we'll go over the 2-week pre-op diet, post-op meal plan, your vitamins and supplements, and we'll talk about the hospital stay and experience. At your readiness visit with myself, the physician assistant, or the nurse practitioner, we'll go over your medications. We may need to make some medication adjustments at that time. We'll review your tests and studies, make sure all our T's are crossed and I's dotted. We'll discuss post-op lifestyle and just answer any questions that you might have at that time. When you see your surgeon, we call this a history and physical. There will be a brief exam. Your surgeon will review all your tests and studies and your process or progress through the program. We'll review the consents for the surgery and answer any questions that you might have. The pre-op diet is a 2-week diet. It's mostly liquids, and the purpose of this is to burn off the majority of the fat in your liver. It really works very well at doing this. We want that liver fat gone to help improve surgical outcomes. It also helps to clear out your intestines and get you ready for eating after bariatric surgery. We go over that in detail at our surgery class just before surgery. Majority of our patients have surgery here at the American Center. About 70 to 80% of our patients will go home after the first night in the hospital, and the rest will be 1 or 2 nights in the hospital. It really just depends on your process of recovery. At home, it typically takes about 3 weeks before you're 100%. I recommend that you not go back to work until about 3 weeks after surgery, and if your job is very, very physical, that it may be a month or longer before you go back. Post-op, we will see you frequently that first year. At the 2-week post-op period, you'll come in and see either myself, the physician assistant, or the nurse practitioner, or more commonly, your surgeon. You will also see the dietitian. At 6 weeks, you follow up with myself or the nurse practitioner and the dietitian. At all your follow-up visits, you'll be seeing the dietitian. At the 3-month post-op visit, we will do labs, as well as at the 6-month post-op visit. 9-month post-op visit is only on as needed. If you're struggling at the 6-month visit, we're going to want to see you at 9 months. If you're doing fantastically, we'll wait till your 1-year visit to follow up. We'll see you again at 1 year, and then again 6 months later at your 18-month, and then yearly thereafter. Again, when you come in to see us, you will be seeing the dietitian and typically a mid-level provider such as myself or a nurse practitioner, and on occasion and as necessary, our health psychologists. And we will do labs periodically to make sure that nutritionally you are where you need to be. These are really important visits to maintain or to help problem solve and keep you motivated and on track. We ask for a lot of changes in your lifestyle, and old habits are always still there. It's easy to slide back into them. So follow-up really is key at maintaining your long-term success habits.